Angela are proud of you. I want to commend the committee for such a wonderful report, especially to the hard-to-reach areas. We feel represented very well. The Honorable Chair, thank you for listening to our cry, especially, Mr. Speaker, the issue of ambulances that were not fueled. They were not given fuel in the NDB4, but now that you have brought it out, we are grateful and we are hopeful that this fuel is going to come to us, not only in words, Mr. Speaker, but in action. On page, Mr. Speaker, on 29th March 2025, I wanted to give you why we are saying we are happy that we are going to get fuel. There is a lady who was coming from Banda Island. She was going to give birth, but she gave birth in the middle of the lake and in a very ugly boat. So when we have these ambulances functional and very well fueled, we are going to be happy and honored to get them. Mr. Speaker, secondly, on page 21, you gave a recommendation that the committee recommends that the ministry should allocate specific time and days when the boat ambulances should move so that the public is aware of the schedule. Mr. Speaker, a health condition cannot be allocated time. You cannot tell somebody to get sick tomorrow. So why, I don't agree with the committee on this recommendation, because say for example in the islands, you cannot tell somebody to get sick and the ambulance moves or doesn't move. The ambulance must be stationed somewhere ready to move at any time. Yeah? Because if, for example, somebody gets COVID-19 and they have the signs, you mean you're going to wait for Sunday and it is a Monday? So I believe, I think, Mr. Speaker, this recommendation should be removed from the committee report because it doesn't really make sense for me as a member of parliament from the hard-to-reach areas. I thank you so much, Mr. Speaker.
Thank you. I don't mind about the recommendation because it's not of a budgetary nature. Okay? So the recommendations which we refer to the committee as per Rule 149(2) of our rules of procedure are those that need reconciliation, harmonization, and consolidation into the budget. So since it's not of a budgetary nature, and as well be
much
ignored.
obliged, Mr. Speaker.
Thank you, Honorable. Yes.
Thank you, Right Honorable Speaker and Chair for the committee for the reports. But my concern from the report, financing and upgrading lower health facilities. We have a challenge. It's a good proposal, but the challenge is we try as members of parliament like me. We have a health center too, Chabagoma Health Center. We have one room. Everything is done there. I took an initiative to even buy the land for the hospital, but the ministry, we wrote letters. We haven't received any response, but it accommodates like 5,000 people, patients. So we need to look into that. Secondly, when we look at upgrading, we even have sub-counties with no health centers in Bukomansimbi, like Butenga Rural. Yet we passed here that each sub-county has to have a health center. So we have to look at sub-counties with no health centers. Lastly, Honorable Speaker and Chair, if we are upgrading, let us focus on some factors like the population. We have Butenga Health Center 4. It helps people from like 4 districts in Greater Masaka. And we all have one regional referral hospital, that is Masaka. If we are to upgrade, we pray, and we have been here praying. Let us upgrade Butenga Health Center 4 to a hospital. Thank you so much.
Thank you. Honorable Santa, Honorable Atkins, Honorable Ongisto, Honorable Waru, Honorable Barimozo,